Have you ever pondered about the silent killers that lurk within our bodies, undetected until it's too late? One such silent threat is kidney disease, a condition often overlooked, yet its impact is anything but insignificant. Kidney disease is like a covert operator, quietly disrupting your body's operations without raising alarms. It's a malady that often remains unnoticed until it has advanced to late stages. This is why routine screening for kidney disease is not just crucial, it's a necessity. It's akin to having your own internal surveillance system, detecting threats before they cause irreversible damage. Yet many people are living with kidney disease, oblivious to its presence. Picture this. You are hosting an uninvited guest who is slowly wreaking havoc and you don't even know it. Alarming, isn't it? This is why understanding kidney disease, its symptoms and implications is paramount. The purpose of this video, then, is to shed light on this silent threat. We will unravel the intricacies of kidney disease, dissecting its symptoms and understanding what they mean for your body. This is not just about medical knowledge, this is about empowering you to understand your body better, to recognize when it's sending you distress signals, and to take action that could potentially save your life. So let's begin our journey into the world of kidney disease. Let's explore the signs that your kidneys may be in trouble. From anemia and fatigue to changes in your urine and skin, each symptom tells a story. A story that, if interpreted correctly, can lead to early detection and effective management of kidney disease. Understanding the signs of kidney disease can be a life-saving knowledge. Let's delve into its symptoms. One of the first signs of kidney disease is anemia, which manifests as fatigue, weakness, and shortness of breath. You see, our kidneys are rather remarkable organs. Not only do they filter waste from our blood, but they're also responsible for producing a vital hormone known as erythropoietin. This hormone tells our bone marrow to create red blood cells, which are essential for carrying oxygen around our bodies. However, when our kidneys are not performing at their best, they may fail to produce enough erythropoietin. This leads to a shortage of red blood cells, a condition we know as anemia. Without enough red blood cells, our bodies lack the necessary oxygen to function properly, resulting in feelings of fatigue and weakness. You might also find yourself short of breath, even when doing simple tasks that you previously had no trouble with. Now, you might be wondering, why does this matter? Well, the implications of anemia on our daily life and health are far-reaching. Fatigue and weakness can significantly impact your quality of life, affecting your ability to work, exercise, and even enjoy social activities. Moreover, anemia can worsen other conditions like heart disease, as your heart has to work harder to deliver oxygen to your body. Furthermore, anemia can be a sign that your kidneys are not functioning as they should be, potentially indicating kidney disease. Early detection of kidney disease is crucial, as it allows for prompt treatment and can slow the progression of the disease. So, if you're feeling unusually tired or weak, or you're experiencing shortness of breath, it might be worth having a chat with your healthcare provider. Anemia is just the tip of the iceberg. There are other early signs to look out for. So let's delve deeper into the world of kidney disease and uncover what those signs might be. Blood in the urine and foamy urine are clear red flags of kidney disease. Now let's delve into why these symptoms occur. Our kidneys, the silent warriors, are ceaselessly working to filter out waste from our bloodstream. But when damaged, they may inadvertently leak blood cells into the urine. This is what causes hematuria, or blood in the urine. It's not something you typically notice unless you're stricken by a case of microscopic hematuria, where the urine visibly turns pink or cola-colored. Now let's move on to another symptom, foamy urine. Imagine the froth on a freshly poured beer. If your urine looks similar to that, it's a sign that there might be an excessive amount of protein in your urine, a condition known as proteinuria. The kidneys, when functioning optimally, retain protein for the body's use. But when they're impaired, protein slips through and ends up in the urine, causing it to foam. Now, you might be wondering, what does this mean for my health? Well, these symptoms indicate that your kidneys aren't filtering your blood as they should. This can lead to a buildup of toxins and waste in your body, which can cause a host of other health problems. Moreover, these symptoms are often silent, meaning they can go unnoticed until the disease has progressed significantly. That's why it's important to be vigilant about changes in your urine. If you notice blood or foam, don't dismiss them as mere oddities. They could be your body's way of alerting you to a serious issue. These signs are not to be ignored, but the symptoms don't stop there. As we continue to delve into the world of kidney disease, we'll uncover more symptoms that can serve as warning signs. So stay tuned as we unmask this silent disease. Nocturnal bathroom trips and swelling in the ankles, feet and legs are signs your kidneys are struggling. When kidneys falter, they lose their ability to effectively filter fluid and salt. This malfunction can lead to a buildup of fluid in the body, a condition known as edema. This excess fluid can accumulate in different parts of your body, particularly in the ankles, feet and legs. Why does this happen? It might help to think of your kidneys as your body's dedicated cleanup crew. They work tirelessly around the clock to cleanse your bloodstream of waste and excess substances, including fluid and salt. When the kidneys are healthy, they can balance these elements perfectly. But when they're compromised, they can't keep up with the demand, and the balance begins to tilt. The result? Fluid retention. And this can manifest as swelling, a visual and physical sign that something is amiss. But it's not just about appearances. This symptom can be uncomfortable, even painful, and can limit mobility. It's a disruption to daily life, making even simple tasks like walking or standing more difficult. Moreover, this swelling is a symptom that your body is holding on to more fluid than it should. This excess fluid can increase your blood pressure and strain your heart, leading to more serious health issues like heart disease. It's a ripple effect, a small sign of a bigger problem. It's important to remember that these symptoms might not always be constant. They can come and go, ebb and flow. But even if they seem to disappear, it doesn't mean the underlying issue has resolved. It's merely lying low, waiting to resurface. So if you notice persistent swelling in your ankles, feet or legs, or if you find yourself waking up often during the night to use the bathroom, don't discount these signs. They might be your body's way of telling you that your kidneys need help. The symptoms we've discussed so far might seem subtle, but as the disease progresses, they become more severe. In the later stages of kidney disease, your skin might start telling the tale. The skin, our largest organ, is a mirror that reflects what's happening inside our bodies. With kidney disease, this reflection often reveals a story of struggle. As the kidneys falter in their critical role of filtering toxins from the bloodstream, these toxins start to build up, often leading to visible changes in the skin. Rough and scaly skin is a common manifestation. Your skin may feel like sandpaper, coarse and dry to the touch. This isn't merely an aesthetic issue. It can cause discomfort, even pain, and can severely affect your quality of life. Itching, known medically as pruritus, is another symptom that can arise. This is not the occasional itch that we all experience, but a persistent, all-consuming itch that can keep you awake at night and distract you during the day. It's the kind of itch that creams and lotions can't soothe because it's not a surface problem. It's a sign of toxins building up beneath the skin. Changes in skin color and texture are also part of the narrative your skin might share. You might notice your skin becoming darker, or there might be a yellowish hue, a sign of jaundice. The texture can change too, becoming thinner or thicker, even altering the way your skin folds and creases. These skin changes are not just cosmetic concerns, they are distress signals from your body, indicating that your kidneys are struggling. They're a sign that your body is retaining toxins that your kidneys should be filtering out. This impacts not just your health, but also your daily life. The persistent itching can be distracting, the rough and scaly skin can be uncomfortable, and the changes in color and texture can affect your self-esteem. But it's crucial to remember that these symptoms are not the disease itself. They're the signs, the hints that your body gives you to seek help and treatment. Even the smallest changes in your skin could be a sign of something far more serious. So, it's essential to listen to what your skin is trying to tell you. Pay attention to its story. It might just be the tale that leads to early detection, to treatment, and ultimately to a healthier life. Restless leg syndrome is more common in end-stage kidney disease than you might think. At the root of this condition is the failure of the kidneys to perform one of their key functions, filtering toxins from our blood. When these toxins build up, they can lead to a host of problems, one of them being restless legs syndrome. Let's delve a bit deeper. Our kidneys work tirelessly, acting as natural purifiers, removing waste products and excess substances from our blood. However, when kidneys are compromised, as in end-stage kidney disease, they struggle with this crucial task. The toxins that should have been expelled start to accumulate in the bloodstream. This toxic buildup can have various effects on the body, and one of the areas it impacts is the nervous system. Restless leg syndrome, characterized by an uncontrollable urge to move one's legs, is a neurological disorder. It's thought that the buildup of toxins interferes with the normal functioning of the nerves in the legs, leading to the discomfort and restlessness associated with this syndrome. But the implications of restless leg syndrome extend beyond mere discomfort. The condition can significantly impact sleep, leading to insomnia in severe cases. And we all know how vital a good night's sleep is for our overall health and well-being. Lack of sleep can have a ripple effect, leading to issues like fatigue, decreased immunity, and impaired mental function. Furthermore, the presence of restless leg syndrome can be a clear indicator that the kidneys are failing to filter toxins effectively, signaling advanced kidney disease. It adds another piece to the puzzle, helping in the overall diagnosis and understanding of the health condition. So, while restless leg syndrome can be a distressing condition to live with, it's important to remember that it can also be a sign of something far more serious. Restless legs syndrome can be a clear sign of kidney disease, adding to the importance of recognizing these symptoms. Kidney disease is a silent, often undetected killer that can dramatically affect the quality of life. This is a fact we've explored in depth today, and as we wrap up, it's important to underline the nuances of this condition one more time. The early signs of kidney disease are subtle and often mistaken for other conditions. Anemia, characterized by fatigue, weakness, and shortness of breath, can be easily overlooked. Similarly, blood in the urine or foamy urine due to protein leakage might not raise immediate alarm bells. Yet these are the body's early warning signals that the kidneys are not functioning as they should. As the disease progresses, symptoms become more apparent. Frequent nocturnal bathroom trips and swelling in the ankles, feet and legs are signs that the kidneys are struggling to filter fluid and salt. And then there are changes in skin color and texture, rough and scaly skin, itching and nail abnormalities, all resulting from toxins building up in the bloodstream. Restless legs syndrome, a common occurrence in those with end-stage kidney disease, can be a significant indicator of deteriorating kidney health. The takeaway here is that kidney disease doesn't announce itself with a bang. It creeps in, quietly, stealthily, often masquerading as other, less serious conditions. It's a silent intruder that can cause irreversible damage if not detected and managed early. That's why regular health checkups and screenings are so critical. They provide an opportunity to catch the disease in its early stages, where management and treatment can make a significant difference. It's about being proactive, about taking control of your health. So pay attention to your body. Listen to its whispers before they become screams. The small signs that we often dismiss could be the very clues we need to detect a problem that's brewing beneath the surface. Understanding and recognizing the signs of kidney disease isn't just about knowledge. It's about saving lives. And that, dear listeners, is the most important message we can take away from today's discussion.